Hi guys, welcome back to Dr. Secrets. This is your pal and host, Dr. Sal, and in today's episode, let's take a look at Champix. Now, this is a smoking cessation aid, and so far I would say it is the most effective one I've come across for helping smokers quit thus far in my career. A brief introduction about it is it comes as a tablet in two different strengths, 0.5 milligrams and 1 milligram. The 0.5 is a starter dose. Get your body prepped and used to it. And then the 1 milligram is the work dose, or the actual effective dose, which you will then take for a course of 12 weeks or 3 months. Hopefully at the conclusion of that, you are smoke-free. So that being said, it's very effective, but now let's look at some complications from it. Some of the 5 most common side effects that you might experience on it, as reported by the manufacturer, and then I'll look at some solutions that I've used in my actual practice. So the study that I'm going to report came from the manufacturer, and it was done on the 1 milligram dose. So this fella here, that's what was studied. And the number in the study, so N, was 821 patients over this course of it. So the first most common side effect by far in 30% of people, so roughly 1 in every 3 users, was nausea, getting an upset stomach. And I've seen this repeatedly in my practice. One of the simple workarounds for the nausea is simply making sure that your tummy is full of food with each dose. There have been a few cases where somebody was just so intolerant of it that I've had to dial their dose back from 1 milligram to 0.5 milligrams. But obviously you're losing some of the effectiveness if you do that. In most cases though, if you take this stuff with food, a nice large meal, that buffers the exposure to your stomach. Think of it of if you just take a jalapeno pepper and start chewing on it versus mixing it in with a bowl of beans and then eating it. The buffering effect of the surrounding food around it kind of dilutes the burn from it, or the chemical mixture from it. So that's one simple solution for the nausea. Next up was in 18% of people, so roughly 1 in every 5, complained of insomnia. And again, I've seen that in practice. Not so sure how much of that is just the withdrawal off of quitting cigarettes versus the actual drug, but it doesn't matter. In practice for the insomnia, it's not usually dense insomnia or really difficult to bypass. So one simple solution for the insomnia is just use over-the-counter melatonin. In fact, most over-the-counter sleep aids should be able to get you back into slumber. So insomnia, about 1 in every 5 people, or roughly 20%. The next big one in 13% of people was abnormal dreams, or at least that's what the manufacturer describes it as, abnormal dreams. My people will actually tell you it is nightmares, frightful nightmares. The dead coming back to talk to you, being chased by ghouls, all kind of crazy stuff, abnormal dreams. However, what I usually tell them about these nightmares, I don't have a specific solution to them, but to me, logically, if you weigh the balance, the nightmares compared to the nightmare of continuing to smoke, to me, is a small price to pay. It's just for 12 weeks. Get over it. It's not real. You can get through this. So typically, you can get through that. It's just a nuisance for the 3 months, but it's far better than the nuisance of lifelong smoking. The cost to your health, the cost to your pocketbook, etc., etc. We don't even need to go into that there. I think there's pretty much common and standard knowledge now, unless you live in a cave somewhere. All right, so that's for the nightmares. The next big one is in 15% of patients complained of headaches. I'm just going to abbreviate that as headaches, and this was nightmares. So for the headaches, that I typically haven't come across that being a deal breaker where somebody could not continue the medication just because of headaches. And again, I'm not so sure how much of that is because of the medication, how much is from withdrawing off cigarettes. Because if you think about coffee, for example, which a lot of people are also addicted to, when you come off that, you tend to get headaches as well. And there's no medicines involved there. It's just coming off the drug, your brain expecting it, and it's not there. But again, the headaches, typically mild kind of tension type headaches. I haven't really seen anybody with severe migraines from them that had to stop as a consequence of it. I'm sure there's somebody out there that's the case. But in general, it's not usually so bad that I have to change the dose or take them off. All right, and then the fifth one in 8% is constipation. Now, even though the manufacturer lists that as a relatively common side effect, so say 1 in every 10 people, in my personal experience as a clinician, I've never seen anybody come back and say, hey doc, I had to stop this Champix because the constipation just had me too bound up. So I don't think that's really a deal breaker, but just for the odd occasion that maybe someone viewing this video is suffering with that, there's a lot of over-the-counter products you can take as a solution to that. You could take stool softeners, you could take Senecot, you can take bulking agents like Metamucil. You could even try probiotics. So in general, constipation, I've never seen that be a barrier to somebody deriving the benefits from Champix. So one of the things I really like about Champix is it's just a temporary course. So unlike some other drugs where you're selling your soul forever, it's just temporary, 12 weeks, done. But its strength is also to some degree its weakness, because I've also seen people who have been successfully quit, and then after their 3 months is up, usually somewhere about a year later, they've relapsed. So I have a solution for that too. What I typically do for these folks is if their insurance will cover a longer course, sometimes I'll extend the Champix longer. But many drug plans will only pay for it once in a year or once in a lifetime or something of that nature. So another option is to switch them to Zyban, which is also bupropion. And I've done a video on that drug too. Because Zyban, also known as Wellbutrin, also known as bupropion, has no lifetime limit. You can stay on that for a decade if you needed to, or a century if you're living that long, to prevent any relapsing. So typically, if somebody has tried Champix before, they quit, and then they come back and a year later they say, doc, man, I messed up, I'm smoking again, something stressful happened, I'm back on a pack a day. What I'll often do is use the Champix again, get them quit, then I'll convert them over to the Zyban, and sometimes I'll use that for a year or two. You see, the longer you could stay away from the cigarettes, the longer the likelihood that you will keep staying away from the cigarettes. So if I can keep you off cigarettes for a couple years by doing this strategy, there's a good chance you're never going to go back to them. So anyway, guys, I hope that was helpful. That is what I know so far about Champix and its side effects, and some workarounds so you can still get the benefit from it.
Thanks for watching. Get notified of new videos. Subscribe now.